Hey YouTube, how are you all? I hope you're all really well, healthy and happy. Today is 28th February 2018. It's a Wednesday. Happy birthday to my lovely friend Ange. I don't think she watches these all the time anymore, but sending out lots of love to you. I know it's your birthday today, so yeah. I just wanted to come on and quickly fill you in on my hospital day today, which is part of my bariatric surgery. I've been video logging my journey to and beyond a gastric bypass, which I had almost 1 year ago. My surgiversary is in just over 2 weeks' time, my year surgiversary. So yes, as you probably may be aware, I had a few odd blood sugars, feeling weak and dizzy and very, very faint over Christmas period. Didn't have a clue actually that your blood sugars could be affected by bariatric surgery. So I've learnt an awful lot on this journey, and I went to see an endocrinologist. Really fortunate because I've got private medical, and I got to see a private endocrinologist, Dr. Ung, who then referred me on to have what was called as a mixed meal tolerance test, glucose tolerance test. And basically I spent the day in a hospital. Well, in fact, I didn't spend a day in a hospital as presumed. There's a little bit of confusion here if you follow. I'll just tell it as it is. So I've got private medical. I see a private endocrinologist. All of the private doctors in the UK actually work for the NHS as well. I say all, I'm presuming most of them do. I know the bariatric surgeon that worked on me, or the three of them also work privately and through the NHS. They're the bariatric surgeons in this area. So anyway, I got to see the only private endocrinologist in the area, and she accepted me as a private patient. She was lovely, and she then explained that there are no endocrinologist specialised nurses private, that you then have to be taken through the NHS. So to cut a long story short, I was a bit confused by it, but just kind of going, okay, that means I don't go to a private hospital to have this done. It has to go through an NHS hospital, which is okay. I used to work there. I shouldn't knock it too much. I'm impatient, and you know, going private, half of it is because I don't have to sit and wait on the NHS, and you generally get what you pay for. Sorry, not sorry, guys. I'm gonna just say it as it is. And anyway, we agreed that, well, what could I say? There was no more I could say. I had to go to the NHS hospital to have this done today. So, but whereas my insurance company still pay for this as a private patient, even though I'm going down the same route as the NHS people. But hey ho, let's just say I hope I got in quicker than the NHS would have done anyway. So, sounds like I'm being an awful snob. I'm not, but we pay a lot of money for private insurance every single month for Howie and I, and you know, why shouldn't we use it? We've paid for it, and we've paid for it for those reasons, so that we don't have to sit and wait, etc., etc. I don't have to explain myself. I'm just trying to make it clear. So this morning I had a few anxieties last night about today's testing, and I think it's partly because I am private, but I'm being sent to an NHS hospital, and you know, I think my head was a little bit messed with the confusion of it all. Anyway, it didn't start very well. We took over an hour to get to a hospital that's only half an hour away. The weather's been really bad here, guys. You know, I say really bad. We had a smithering of snow, but it was -11 maybe in the night. So it's pretty cold. And I think a lot of people probably left earlier to get to their workplaces. I don't know. Anyway, it took us longer than expected to get to the hospital. I am generally a super early person. I give myself anxiety if I think I'm going to be late. Half the journey was spent with me extremely anxious because I thought I wasn't going to make the appointment. Then when you get to this absolutely shitty car park in our NHS hospital, that does not cater for the amount of people that the hospital caters for. It's a tailback of queues, and I'm just, you know, so I'm pretty stressed this morning. Hadn't eaten. I had to fast for this testing from the night before, so I'd had a yogurt. Luckily for myself, I'd drank nearly 4 litres of squash yesterday. So I was pretty angry anyway. Just found a parking space, but only one for half an hour. It was an emergency drop-off. Howie was coming with me, and as we pulled into this, he was basically going to get me settled on the ward, and then he'll fly off. He had appointments to go to, and then my phone rang just as we're about to get in the lift and go upstairs, and it was the nurse who was going to look after me saying, "Hi, where are you?" I'm like, "Well, I'm at the hospital. That's where I'm meant to be in 10 minutes, actually." You know, I was 10 minutes before my appointment. And she said, "There's been a change of plan. Can you come somewhere else?" And I'm a bit like, this is what I hope to avoid. Sorry about the moving thing. My cat has decided to jump on the stool where my phone is. PG, come on. So this is what I try and avoid, you see, this kind of, yeah, I don't know what else to say really. So I was really pissed off, like it already started badly. So we get back in the car, we go and find it. Funny enough, I say find the place. It was only over the road, but it's where Howie goes for his diabetes clinic. So we managed to get a parking space there. He took me up and I just, I don't know. I just peed off, I guess, because I wasn't on a ward. I wasn't in a hospital. I was in a room. I want to say old-fashioned. Yeah, they pulled a curtain around a bed and a chair, and she'd obviously had all the equipment that she needed. She's a nurse. She was an endocrinologist nurse. And, you know, I think by the end of the day, I'm telling you all these moans and groans now because it was me. You know, I was pissed off. I was really thirsty, really hungry, hadn't taken my vitamins, and you know, she put the cannula in my arm, and actually she really hurt me. And I'm not a baby like that. I give blood. You know, I donated platelets and things, and I was a bit like, ow. You know, when someone puts, I've got a real bruise coming up there already. Anyway, I shouldn't grumble because she was lovely. She was lovely, and she did a fantastic job. So she put a cannula in my arm, and then I had to drink this most awful, disgusting Ensure drink, which tasted like mouldy bloody apples. Which was, it's funny enough how he looked at it actually, and he said it's not that high in carbs, but anyway, it was supposed to be a highly carbohydrated drink or something, and sugars, and it did make my blood sugars sky high. I rocketed at 14.9. So then, once you've drunk that drink, she then tests my blood sugar by pricking my finger. So I've had every finger pricked both sides today to squeeze blood out of to go into the little thing. So cut a long story short, she did that every 15 minutes. So it went sky high, and then it slowly started coming down. And then I think after the first hour of every 15 minutes, it then drops to, you have your blood, every time she does a blood test, every 15 minutes or half an hour, she then takes blood in a vial, and that gets sent off to the lab so they can test it in a deeper, I don't know what they do with it. But it did actually drop to 3.5. It wasn't as low as I've had in the past. That was actually okay for me. And when it first went to 3.5, I felt absolutely fine, if I'm being honest. I didn't feel any different. So it could happen all the time, and I didn't know that. But she had that. She said, right, now it's gone to 3.5. I need to take this off. Within half an hour, it needs to be at our lab. It will then go to London if Dr. Ung wants your C-peptides checked and for insulinomas. So anyway, it was all, but it didn't go any lower than that. It then started, my pancreas obviously started to work. It produced the insulin, which brought my blood sugars back up to around 4.6. The normal is between 4 and 7. So it wasn't drastic, but I did then start to feel really shaky. You start to get these inside shakes, and it kind of did what they expected it to do. The drink had made my blood sugars spike, and then they needed to see how low they would go and how my pancreas would handle trying to moderate my blood sugar levels again. So yeah, I was there in total, I think, for 5 hours. You're sat there with the cannula and being, you know, drained of blood every few minutes. And then I got Howie to bring me some food, so that I was starving. It's quite funny actually, because I was saying on my Insta story, you know, if you think you're going to lose your hunger hormone, I'm afraid you don't. I know by not eating for 20 hours or drinking, I was gasping for a drink, and I felt dehydrated, you know. I felt like my stomach thought my throat had been cut. Anyway, it was okay. I did it, and I really hope that whatever they're hoping to find in there, they've done enough that I don't have to go and do the 3-day fast, because I can't imagine what kind of a nightmare from hell I'm going to be. 3 days, no eating or drinking just while they check my blood sugars. Maybe I should just give me a general anaesthetic, coma, like put me into a induced coma, and then they can do what they want. Then they can check my blood sugars, and I won't care about not eating, right? I don't know. But anyway, that was my day basically at the hospital. And on the flip side of all my grumbling, in the end, at the end of the day, I actually had a more positive experience, probably because I wasn't on a ward, because that nurse was just one-on-one with me. And what I think would have happened, the other people that she would have been looking after, 3 or 4 normally on a ward doing the mixed meal test, they would have been NHS patients, and they got cancelled this morning because the flu outbreak, and they needed the room they normally use for the flu. But they didn't cancel me because I'm private. So on the flip side of it, it worked out okay, but I was a bit pissed off this morning, to say the least. And you know, it's just not good timing, I guess. I've been on my diet. I did my reset. I just started my period this morning, and I was hangry, and it was like, but I feel a lot better now, obviously, because I've eaten. And Harry's actually cooking dinner tonight, one of Tom Kerridge's. I think he's doing the lamb samosas, which smell divine, actually. So yeah, I'm really looking forward to that. And I'm really proud of myself, actually, because I think on a day like today, when you haven't eaten and I was gagging for some food and drink, I think in the past, even pre 2 weeks ago, I possibly would have gone, stuff it, I really need to treat myself to some goodies, and they would have been baddies, really. And in fact, I got Harry to bring me my roasted vegetables that I'd done in the oven the night before. I got him to bring me some slices of salami and a Baby Bell. And that did it. So I'm actually really proud of myself for the good choices there, because I could have chosen to have stuffed my face with really bad crap, and I didn't. So yeah, the reset from last week, I feel, has done me the power of good. And I can see a lot of people through Instagram that are struggling around this time. Maybe it's the time of year, maybe it's the amount of time you're out from this surgery. And it's kind of good to know, I guess, that you're not alone in it, that it can be a lonely journey if you don't gather that support along the way, which I've merrily done. And you know, I tell you all the time, I've got a fantastic support network that I couldn't have done this without. So yes, I'm sending out lots of love to you all. I just wanted to fill you in while it's fresh in my mind, all about my day at the hospital and my mixed meal test. So I'm not sure what they're going to do. I'll wait to hear from the consultant now. She'll call me back to her, and then we'll talk about how we go from there. Whether she thinks I need to do anything, I don't know. It might just be that it was reactive to something. I don't know. Pain in the side, it's almost gone. I said that yesterday to my friends, and then it flared up again in the afternoon, which was really weird. But today I'm feeling, but again, because I've done nothing, I've sat down with a needle in my arm, so it's kind of resting it has been probably pretty good. But anyway, I hope you're all really well, healthy and happy, and I will chat to you again possibly tomorrow if I've got something to say. What am I on about? I've always got something to say. Thanks for all of your love and support. I'll chat again tomorrow. If you haven't already, please click like and subscribe. See you.